Welcome to Opportunities in Public Health Law, Building an Equity-Minded Workforce. My name is Casey Deems, and I'll be running this Dialogue for Health web forum with my colleague, Jeff Bornstein. Next slide, please. Today's event is sponsored by the PHI Center for Health Leadership and Impact, the Western Region Public Health Training Center, and the National Leadership Academy for the Public's Health. This event was created in partnership with the CDC's Public Health Law Program and ChangeLab Solutions. For today's agenda, we begin with our welcome and introductions. We'll then move into our presentation and discussion on opportunities in public health law, building an equity-minded workforce. We will then have time for an audience question and answer period, and we will then close out the session. Next slide. Now it's time to meet the moderator of today's event, Karya Lustig. Karya is the director of the Program Office CDC Cooperative Agreement and the co-director of the PHI Center for Health Leadership and Impact, which runs the National Leadership Academy for the Public's Health. Welcome, Karya.
Thank you so much, Casey, and looking forward to the conversation today. Going to move into our first presentation. We have Sam Bent-Weber, who is a public health analyst and lead for research, innovation, and workforce capacity building with the Public Health Law Program. PHLP is based in the Division of Partnership Support in the CDC's new National, State, Tribal, Local, and Territorial Public Health Infrastructure and Workforce Center, otherwise known as the Public Health Infrastructure Center. She was previously the acting health equity officer for the public health infrastructure, and she specializes in the development of legal tools for the provision of legal technical assistance to public health agencies and communities around the country. We're going to be introducing each of our speakers as they come on for their presentation. So for now, I'd like to welcome Sam.
Thank you, Karya. And a big thank you to the Academy and the Center for Health Leadership and Practice. Today, we'll be talking about how law is an important public health tool that public health practitioners can access in their efforts to advance health equity. Next slide, please. So I do have to offer a disclaimer. These materials are for instructional purposes and educational purposes only. They do not represent any official position of CDC. They do not represent any agency determination or policy, and they are not meant to provide legal advice to you, your health department, or other organization. I am a licensed attorney, but of course I'm not your attorney, and I'm obligated to say that. And if you do need legal advice, please seek advice from an attorney who's authorized to provide you with those services. Next slide, please. So I'd just like to provide a quick overview of what to expect for my portion of the session. We are devoting a chunk of time today to work that's to sort of looking at concrete activities that are underway in collaboration with our colleagues at ChangeLab Solution to build the capacity of the public health workforce to address social determinants of health and health equity. And of course, the goal is to demonstrate how that's being done by using legal tools. But before we get there, I'd like to provide a high-level overview of the concepts that inform much of our thinking about this idea that law can be a tool to strengthen public health practice, to address pressing health equity challenges. So with that in mind, we're going to spend some time defining key terms and framing this topic, reviewing some existing public health strategies, largely at CDC, and then we'll be outlining how law can serve as a public health tool. And then we'll provide a quick overview of a pathway that public health practitioners and others working in public health adjacent settings can consider when exploring ongoing health equity challenges in your communities. Next slide, please. So let's start with our key terms. Next slide, please. So CDC's Office of Health Equity defines health equity as the state in which everyone has a fair and just opportunity to attain their highest level of health. I really like this definition because it asks us to consider not only disparities or inadequate health care when we assess the circumstances that make it difficult for some populations and communities to have the best possible health. It also asks us to consider the ways that justice and injustice, as well as social and societal factors, have an impact on health. So that definition says achieving this state requires focused and ongoing societal efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles to health and healthcare, and eliminate preventable health disparities. The other piece of this that I think is salient for our conversation today is that this definition notes that health disparities are not inevitable, and that the poor health of populations and communities, particularly those that experience the most extreme disadvantage and persistent disadvantage, can be prevented by addressing justice and societal factors, right? And at the center of justice and societal factors, of course, is law. Next slide, please. So I'd also like to just quickly highlight the social determinants of health as a definition. CDC defines the social determinants of health as those non-medical factors that influence health outcomes. And of course, this term points to the environment that people live in as having the potential to substantially affect the totality of their health. Where they live, the amount of money they make, their sense of political power, the kinds of medical care they have access to, their housing conditions, their school conditions, all of those factors and more are directly linked to health equity and, by extension, health outcomes. The subway map of the DC metro area seeks to make a point that people's health outcomes and life expectancies are shaped by the places where they live. So someone in the DC inner city likely has a lower life expectancy than someone who lives in Fairfax County or Virginia or Montgomery County, Maryland, because of the quality of the conditions of those two places differ. But one other important factor here to consider with this map is that the law in these places is also different. And the law has shaped those differences, the differences in how neighborhoods are zoned and how schools are structured and how the built environment is structured and working conditions and so on. The law plays a powerful role in shaping all of those factors too. And so, even factors like how neighborhoods are redlined or were historically redlined in these neighborhoods, and the longstanding effects of that are reflected in these health outcomes that are in this map. And law is at the center of all of that. Law and policy are at the center of all of that. Next slide, please. So understanding that social and societal factors affect health and give rise to inequitable health outcomes is what led former CDC Director Rochelle Walensky to declare that racism is a public health threat, and to note that the impact of racism in similar systems of disadvantage is pervasive and deeply embedded in our society across a range of social, economic, and other aspects of life, including work, education, housing, economic conditions, to name a few. And so in public health, as in much of our broader society, we have reached an important moment in our discussion about social conditions that affect well-being, including racism. And we're moving beyond a conversation about racism as simply a collection of individual actions that reflect a morally flawed exception that operates outside the norms of society. The idea that, sure, racism happens, but then everything goes back to normal. We're moving past that. And we're moving toward a more comprehensive discussion about racism as a system of structures and practices and policies and norms that create and sustain social, economic, and other conditions that shape well-being and life chances for specific populations. And those conditions bleed out into all aspects of life and for all kinds of populations. And it can be difficult to untangle how all of these pieces and systems of disadvantage are connected to each other. That is in part because they are embedded in laws and policies. Statutes, regulations, rules, policies, implementation practices, judicial opinions, enforcement mechanism, fines, funding allocations for programming, and so on, are all embedded in law. They are all driven by our legal system, and they drive our legal system, and by extension, much of how our society operates. And just as law is a system of rules and policies and practices that can create disadvantage, I want us to focus on what's positive about this too, right? That law is something that can be understood and captured, and be a key factor in transforming those conditions of disadvantage. Law plays a central role in achieving two ends. It can profoundly shape the context in which people live to increase their access to the things that they need and make it easier for people to get the things that they need. And law has the power to redistribute resources and to make the things that people need to live more healthful lives more accessible. And so in order to address these systems of disadvantage that threaten the public's health, like racism, practitioners do well to understand and treat law as a determinant of health and as an accessible and practical tool that can be leveraged to mitigate health inequities. And so I'm really trying to get at the idea that law does not have to live out there. And I assume that for those of you who are on this session, you're here because you believe that too, that law does not have to live out there. That is something that other people who are lawyers do. It's something that any of us can learn about and begin to wrap our heads around and develop the tools and resources to understand and advance health, better health outcomes. Next slide, please. And so with that, by focusing on health equity and just to sort of close the circle on all the stuff I've been saying, public health practice can be stretched, right? If I can say that you don't have to be a lawyer to understand the law, and the law can be demystified for you as an evaluator or an epidemiologist or a policy advocate, then what we're talking about is stretching our approach to public health practice, whether you're working in governmental public health or in a non-governmental setting or community-based setting and so on. And it really means stretching beyond our boundaries and thinking expansively about the role of public health in addressing conditions or matters that extend outside of what we would characterize as traditional public health practice. Next slide, please. And so I'd like to talk briefly about some existing and burgeoning frameworks for incorporating health equity into public health practice. These are high-level frameworks that are still sort of under construction. But again, since we're talking about framing, I just wanted to highlight them here. Next slide, please. So at CDC, we are working, and many colleagues are working to develop frameworks and strategic approaches to addressing health inequities by recognizing the impact of structural racism and other structural and systemic factors on health outcomes. And so by extension, reshaping the way we think about public health work. Next slide, please. These frameworks and strategies seek to go beyond documenting disparities and getting at more than just pulling numbers together and naming the problem. We're looking to emphasize the significance of root causes by engaging in the collection and analysis of data that helps us to better understand these social conditions or social determinants that give rise to health disparities. We are recognizing the importance of providing context for why some populations experience poorer health outcomes than others. And so correspondingly, in developing these frameworks and strategies that move beyond documenting disparities, we're centralizing the importance of policy and health interventions that can facilitate change and ultimately improve health for more people. In so doing, these strategies and frameworks recognize, as I emphasized earlier, the potential necessity of focusing our research and our policy priorities on topical areas that may exist outside of the traditional boundaries of public health, like discrimination or employment policy or labor market conditions. And so this really means focusing on policy solutions that are rooted in science, but that also seek to understand the real context in which people and their communities live and carry out their day-to-day lives and function. Next slide, please. And so related to that, CDC's Office of Health Equity and Office of Science have over the last couple of years worked together to initiate efforts on how CDC can inform or address social determinants of health across a wide range of areas central to public health practice, and doing that by embedding sort of health equity science principles throughout the work that we do and across the work that we do. And so not thinking about, and so one of the principal goals is to, among many, is to begin to treat health equity as an essential feature of how we shape science and data collection and analysis, and not just throw in the health equity piece at the end. Next slide, please. Another framework is looking at the social determinants of health as, again, an interplay of social and structural conditions that are tied to equity. And so parsing some of our approaches to work to capture in really concrete ways sort of how social determinants can fit into traditional and more expansive public health practice. And so thinking about social determinants and centering equity in that thinking about social determinants across work to enhance our data systems, to strengthen our evaluation, to engage communities better, to partner with external organizations, to build and support the building of the public health infrastructure, and of course, supporting initiatives around policy and law. Next slide, please. And so these frameworks also leverage existing approaches to public health practice that you all are familiar with and that center health equity. That includes the 10 essential public health services and Healthy People 2030. And what I think is key for both of these is that they highlight the interplay between sort of law and policy as part of public health practice, civic engagement also as part of health practice, and really placing equity at the center of this work. Next slide, please. And so just to summarize, all of these frameworks that are centering equity and that are helping us to enhance our strategies to incorporate and embed equity into our public health practice. They also recognize that law and policy are a critical part of the infrastructure for public health efforts to advance equity specifically. And so I want to use that as an opportunity to move into sort of talking about law as a public health tool. Next slide, please. And so what is the role of law in this story? We've noted that law has contributed substantially to inequities in health, racism, and other sources of inequity that are embedded in laws and policies. But we want to think about law as something that can concretely be leveraged by public health practitioners. And indeed, it has been central to improving public health. We know that because we can draw upon the legacy of the 10 great public health achievements, like the mandating of seatbelt usage and efforts to establish and maintain clean air and clean water, and improve our food safety standards. So we know that law has the potential to do a lot of work in public health space. And so when we're thinking about how law is critical for public health practice as it pertains to health equity, I just want to highlight these 3 areas. Law can be learned, right? I've said this earlier, it can be learned and it can be studied through legal epidemiology and other approaches to public health law research, and you don't have to be a lawyer to do that. Law that can be learned can be translated. That means it can be explained to people who are not lawyers. And in learning law, we all have the ability to not just translate it and explain it in a functional way, but really tie how law has an impact on health to the stories and experiences of real people. And law that can be learned and translated can facilitate efforts to improve health. I just want to unpack each of those statements briefly. Next slide, please. So in learning about law, we can do that in really systematic and accessible ways. Legal epidemiology is an approach to studying law that allows us to begin to understand what the law says, essentially, and what the law does. But there are other ways, in addition to legal epidemiology, there are other ways of conducting public health law research to begin to sort of trace the connections among the sources of systemic health inequities, laws, and health outcomes. Doing that work can help us to gather better context for findings in disparities research and other research that explains that some populations experience disadvantage more so than others. And by studying and learning about laws in systematic ways, we can better identify the drivers of health disparities and inequitable health outcomes. And we can do that across race, gender, socioeconomic status, geography, and other factors. Next slide, please. And laws and policies can be translated, as I said before, to better explain that relationship between systemic inequities and health outcomes. One of the things we talk about a lot in public health practice is that stories are a key feature of public health practice, tying what happens in public health to the experiences of real people can help us better understand sort of what public health is and how public health works. And that applies with the law too. And at the center of every system or practice that gives rise to harmful health outcomes, and at the center of every system or practice that gives rise to beneficial and positive health outcomes, are the stories of people, real people who have to navigate the law and navigate institutions and systems, and sometimes struggle to do that and figure out ways to overcome that. And we can do that by using public health research to document what those laws are and what those systems are, and tie them to the experiences of real people in real communities. Next slide, please. And so in putting all of that together, if we can better understand the law, we can look at the law in a systematic way. If we can translate the law, excuse me, in ways that are accessible and real for real people, we can identify strategies and approaches to inform and engage policy interventions that can advance health and advance health in equitable ways. Next slide, please. And so I'd like to just sort of put the pieces of that together by looking at a fairly, I hope a fairly straightforward tool that we've characterized as a pathway for public health law and health equity, and that I hope can help to inform some of the discussion that my colleagues from Change Lab will cover. Next slide, please. So this pathway for public health law and health equity is really meant to provide public health practitioners with a series of practical steps for incorporating the study and analysis of law and policies into their initiatives to pursue health equity. So this is really about ways of thinking about how public health practitioners in really concrete ways can take on the skills and the tools necessary to better understand local, state, and federal laws that have an impact on health and have an impact on health outcomes, particularly for communities that experience disadvantage. This pathway is meant to be community-centered and contextual. So it means taking an approach to public health practice that relies on an expansive look at what expertise means, looking at community partners and community actors to inform our thinking and strategies for doing public health law research. It also outlines some of the steps. It includes sort of 5 areas of emphasis. So you start by identifying local health equity challenges. What's the issue in our community that we've identified as truly pressing? Is it a lack of green space? Is it a community or city plan relating to food access? Is it centered on housing issues, high incidences of asthma connected to housing construction in particular parts of your city? Whatever those health equity challenges are, putting your heads together as a team and in partnership with community members to identify critical local health equity challenges. In so doing, if your starting point is that we can identify these local challenges and recognize that law has a role to play here, then we can think about law as a determinant of health, as something that has a key role for us to engage with in our work. And then it can involve studying law, really unpacking what the law says and what it does, and maybe comparing the law in your jurisdiction to the law in other jurisdictions and other localities or states that are similar, and assessing its impact on health outcomes. That means using not only collaborative methods, but also systematic and transparent methods for conducting that research. Then and applying legal epidemiology research where it's necessary. And then using sort of legal concepts to tell the story of the nexus between the law and the impact of the law as it is written, as it is practiced, as it is implemented on health outcomes within that community or within a group of communities, and really sort of deploying the translational and narrative and storytelling dimensions of law and policy. And then, and finally, using those approaches and invoking the law to think about how to develop policy change and develop strategies for change. This pathway as outlined here is a work in progress. We are constantly trying to think about how to update it, and we invite your feedback and reflections on it. Next slide, please. And so I also just want to close by providing an overview of how the public health law program sort of is related to that pathway. We want to support public health practitioners, whether you're working in health department settings or in other settings, in public health adjacent settings, to sort of move along the steps of that pathway. And we do that through research, innovation, and dissemination. We support public health practitioners and researchers who are interested in legal epidemiology and other public health law research tools, and we provide technical assistance, trainings, and other kinds of support in those efforts. We also have a workforce development and capacity building component to that work. Not only do we support public health practitioners in doing research, but we also support public health practitioners in doing other, in just sort of understanding public health law more broadly, and through a number of resources, some of which we'll cover here today. And we also partner with external organizations, state, tribal, local, and territorial health departments, as well as sort of public health adjacent entities to develop collaborative approaches to addressing health equity and other challenges. So all of that put together, there are lots of really concrete ways that public health practitioners can sort of identify and leverage legal and policy tools to advance their work and to advance health equity. And with all of that in mind, I'm going to end here and pass it back to Karya to introduce my colleagues from Change Lab. Thank you.
Thank you so much, Sam. That's packed full of some really rich information. And as a reminder, if questions are coming up as people are digesting that, feel free to type those into the Q&A as our next speakers begin, and we will get to those questions when we get to the Q&A portion. So I'd now like to introduce our Change Lab Solutions team. We have Alexis Ito. She's the managing director at Change Lab Solutions, where she leads multidisciplinary teams of lawyers, planners, and policy analysts in developing trainings and resources that build health departments' capacity to use the tools of law and policy to advance health equity. She also works on legal and policy issues that relate to children's mental health, as well as the intersection of education and health justice. So welcome, Alexis. And then we have Jessica Wynn as a senior planner at Change Lab Solutions. Jessica supports planning and policy work related to health equity, active living, transportation, and housing. Before joining Change Lab Solutions, she worked as a consultant on bicycle and pedestrian planning projects, safe routes to schools programs, and traffic safety analysis. She also has experience in community engagement, program evaluation, and affordable housing advocacy. So welcome to Alexis and Jessica.
Thanks so much, Karya, and also to the Academy for the opportunity to be part of this important conversation. Jessica and I are both very excited to be able to talk about some of the concrete opportunities in public health law that are directly connected and responsive to many of the themes that Sam just talked about. Before jumping in, though, we just have a couple quick notes, starting with the next slide, please. So first, for those who may not be familiar with us, Change Lab Solutions is a nonpartisan, nonprofit organization that uses the tools of law and policy to advance health equity. We partner with communities across the nation to improve health and opportunity by changing harmful laws, policies, and systems. Our interdisciplinary team works with community organizations, governments, and institutions to design and implement equity-centered and practical policy solutions to complex health challenges. And to learn more, I encourage you to explore our resources on our website, which I believe we included in the chat here. Next slide, please. And then because we have folks on staff who are attorneys, including myself, we just want to note that for today's presentation, it does not constitute legal advice, but is provided for informational purposes only. Change Lab does not enter into attorney-client relationships. Next slide, please. And then just finally, this training was made possible in part by a cooperative agreement with the CDC. And just noting that the views expressed in the training don't represent the official policies of HHS or the CDC. Next slide. Okay, so today we'll be highlighting findings from two multi-year projects. We'll first share a bit of the context that inspired and really helped shape the focus of these projects, many of which Sam has already laid the foundation for. Then Jessica will spotlight 2 qualitative assessments that we conducted and the findings from each. And finally, we'll conclude with some of the resources and opportunities currently underway that are responsive to the challenges and needs that we heard from the fields. Next slide. So starting with the first question, what did we know? I'm just going to briefly touch on 3 points that will be very familiar, I'm sure, to many of you because there is such robust research and data to really support each of these points, but I think they're really important to highlight again here just because they played such a critical role in informing our thinking. So next slide, please. So first, just kind of harkening back to what Sam had shared, we know that law is a key determinant of health. There is a long-standing body of research demonstrating that systemic racism and other forms of structural discrimination are embedded in and perpetuated by laws and policies. They shape how people earn money, how they access food, use transportation, how they find housing, exercise, they interact with police and courts, and how they obtain and where they obtain an education. Understanding how racism and other forms of structural discrimination, social control, bias, and privilege, as well as the political and legal systems in which they are all embedded, how those influence the social determinants of health really offers a fundamental shift in how we as public health practitioners can promote health and more specifically health equity. So again, on this slide is a map similar to the DC Metro map that Sam shared earlier. And here it's showing differences in life expectancy between neighboring counties along a highway in California. So at the top is Merced County, where the life expectancy is 87 years, which is 12 years more than neighboring Fresno County, where life expectancy is 75 years. And the point I just want to again reiterate here is the importance of understanding the legal landscape, and in this case, more specifically, the local legal landscape, which can really shed invaluable insights into what might account for these differences in life expectancy. For example, Merced County law may include specific regulations about housing or zoning, about road safety or clean water that Fresno County does not. Or maybe Merced County and Fresno County have the same laws, but they just differ in how they may implement or enforce those laws. The kind of last piece I want to highlight here too is that the health outcomes we see today don't, of course, exist in a vacuum, and there may also be historical, environmental, and socioeconomic factors that are at play. And in this case, I think Fresno is a really good example of how some of the highest poverty rates in the state of California because of the lingering effects of discriminatory zoning rules and segregation policies that ultimately led to the concentrated wealth and development in more affluent and predominantly white neighborhoods in the north of the county, while residents of color and with lower incomes were forced to live in the southwest, closer to slaughterhouses and meatpacking plants. So I think that's another point I just want to underscore too, is that as laws and policies have perpetuated structural discrimination against some communities, they have also led to the benefits and concentrated wealth of other predominantly white communities. And again, this is not unique to Fresno. I'm sure you all have seen similar maps too, and perhaps can think of your own neighborhoods or communities within which you work and some of the same policies that are unfortunately have historically been at play and continue to be at play today. Next slide, please. So the second foundational point I just want to uplift is the important role that law plays. On the previous slide, we talked about the important connections between law and shaping health outcomes. And as importantly, the law can be a really powerful tool in the public health practitioner's toolbox, as Sam did such a wonderful job illustrating. And so when we as public health practitioners are working to improve health outcomes, having a clear understanding of our legal system and its role, both historically and present day, in affecting population health and equity is really critical. And similarly, having an understanding of how to utilize the tools of law and policy or leverage public health powers to shape laws and policies affecting health outcomes is a needed capacity, especially because most public health practitioners are not attorneys. And more specifically, public health law is not part of most public health, medical, or nursing trainings. And this is an important training gap that we'll be revisiting. Jessica will be elaborating more on this in a moment. So let's put a pin in that. Okay, next slide. And then the third point I want to mention is that we've seen growing awareness of and a commitment among state and local health departments and leaders to work on health equity in their as well. 85% of practitioners think that their agency should work on health equity, according to the PHWIN survey from a few years ago. Yet, according to the NACCHO 2019 profile, the majority, 92% of local health department leaders are white. So there's a real disconnect between agency leadership, who may not have the lived experience of being negatively affected by systems of oppression that communities that they serve, or even that their own staff on the ground and within their health departments have and continue to experience. And while there has been a growing body of work and reports the past several years that have sought to identify these challenges and others, as well as opportunities in the U.S. public health system, whether it's addressing chronic underinvestment, some of these EDI goals, and also how to address the workforce shortages, we've heard a real need from folks in health departments when it comes to identifying the concrete action steps. We know that many public health practitioners are committed to doing the work, but don't often know where to start or how to navigate some of the structural, legal, or political barriers that may inhibit the work. Next slide. And the reason why I'm highlighting these 3 points is because they really are the breadcrumbs for addressing the training and practice gaps in the field, and they undergird how we, in partnership with CDC's Public Health Law program, are really striving to support practitioners across their entire career. Sorry, it sounds like there's a lag. I'm going to try turning off my video. Apologies for my connection. Again, this is just how we're thinking about supporting practitioners across their entire career, starting with before they even enter the workforce. So for example, starting on the left side of the screen, what are the classes and curricula that folks receive in their educational careers that could build baseline understandings of public health law and prepare them for careers in public health? Moving to the middle, what are the entry-level opportunities for folks early in their career to gain hands-on public health experience and start building relationships with their community? And then finally, what are the training needs and opportunities that could help seed the field for the next generation of public health practitioners and build the capacity of mid-career and more experienced practitioners to use the tools of law and policy to improve health outcomes? We'll revisit this roadmap again towards the end when we talk about how all of the pieces fit together, but we wanted to just introduce it now to provide a backdrop of the qualitative research that Jessica will talk about now.
Great, thanks, Alexis. If we could go to the next slide, thank you. So in 2020 and 2021, we conducted 2 12-month assessments, one that focused on the academic landscape and how frequently public health law is taught in schools and programs of public health, and then a second assessment that focused on the current workforce, specifically to what extent health departments across the country were using the tools of law and policy to address the social determinants of health and advance health equity. Next slide, please. For the first assessment, we wanted to go further upstream or earlier in the career lifespan of public health practitioners to see how they were being prepared to enter the workforce, what challenges and opportunities there may be for standardizing training in public health. We started with MPH, or Masters in Public Health programs, as one educational pathway that public health practitioners take. We know it's not the only one, but it is a core learning space for public health practitioners. And in order to better understand the current educational landscape, we conducted a scan of all 190 accredited schools and programs of public health to understand their course offerings, course development and approval processes, and faculty makeup and training opportunities. We analyzed the data for themes and trends. We also compared different competency models, including the Council on Education for Public Health, or CEEF, and we conducted key informant interviews with faculty members and administrators in MPH programs. Next slide. So at a high level, we learned that public health law is discussed broadly and inconsistently within MPH programs, that it's dependent on faculty expertise and school resources, that accreditation requirements play a huge role in curriculum development, and that there's a lot of interest in public health education. Next slide. So first I'll share some data from our environmental scan of the 190 accredited schools and programs of public health. So to do this, we looked at publicly available information on curriculum requirements, course offering, and syllabi. And while the majority of public health schools and programs have at least one course that touches on public health law content, the material is often broadly focused and it's generally not required for graduation. So about 36% of the schools and programs have a course that teaches public health law concepts at least a broad level, but only about 17% of them have a whole course dedicated to PHL topics, and only 13 of those schools or programs have at least one course that's required for graduation. Next slide. The next finding is that faculty's familiarity with public health law and resources really influence course development. Next slide. So when law is taught, it's most often in the context of ethics, legal powers and application of the law, and advocacy or policy. This was not entirely surprising, as these topics closely align with many of the policy and public health core competencies in CEEF accreditation. There was a lack of consistency in how public health is integrated into MPH programs and curriculum development. In our scan, we found that about 67% of the accredited schools do not have a faculty member with a JD degree. While it's certainly possible to have expertise and teach courses in public health law without having a JD, some of the interviewees did share about their lack of comfort in teaching PHL concepts when they didn't have a background in it. There was not a clear pattern or correlation that could be drawn between the number of law topics addressed within courses and the number of faculty members with the JD, but course offerings that address public health law concepts are largely dependent on program size. So about a third of the interviewees mentioned budget constraints as a factor contributing to teaching PHL courses. Depending on the institutional structure, faculty often must dedicate a certain percentage of their time to teaching, research, or other university-related projects. There's often little resources and support to allocate towards teaching and training PHL concepts for faculty. And in addition, one participant emphasized how little funding there was for lawyers to get grants inside of a school of public health to develop or teach PHL courses. Next slide. So next, I'll talk about some of the challenges and opportunities with accreditation requirements. Next slide. So CEEF accreditation requirements strongly influence the curriculum for the courses that are taught. The key informants all identified CEEF accreditation as a significant factor influencing their ability to change a program or course. While it is a relatively easy process to develop or change an elective course, existing accreditation requirements take precedence over elective course offerings, especially for smaller programs. And as previously noted, the topics that are taught closely align with many of the policy and public health core competencies for CEEF accreditation. But this also presents an opportunity for standardization of MPH curriculum. Next slide. And lastly, we've seen a growing interest in public health over the last few years. Next slide. So key informants also noted that relevancy or timeliness is a significant driver of course offerings. Faculty said that due to current events, it's critical that course content be responsive to adequately prepare students for the context in which they'll practice public health. All of the faculty emphasized that public health law is an important knowledge area for MPH students, and this is an opinion that's increasingly reflected by the field. The COVID-19 pandemic has led to both an increased awareness of public health and also an increased interest in public health education. According to the Association of Schools and Programs of Public Health, or ASPPH, applications to graduate level public health programs nationwide increased by 40% between 2020 and 2021. Okay, so now I'm going to shift to the second assessment about health departments and the extent to which they were using the tools of law and policy to address the social determinants of health and advance health equity. To do this, we conducted interviews with representatives from state, tribal, local, and territorial health departments. We reviewed community health needs assessments and improvement plan documents. And we also conducted an environmental scan to look at how health departments define health equity and SEOH, how they're currently using law and policy in their work, their challenges and opportunities, and how they're going about cross-sector collaboration and community engagement. Next slide. So we had identified themes related to readiness, framing around SEOH and health equity, and an increased focus on racial equity and some challenges and opportunities. Next slide. So we'll start with the continuum of readiness. Still, health departments fall across a wide continuum of readiness and vary greatly in the extent to which they engage in law and policy work, how they're working upstream to address the SEOH and promote health equity, and how they engage with communities and other government partners to address health disparities. Readiness here refers to health department's capacity, ability, and interest in working on law and policy, the social determinants of health and health equity. And different dimensions of readiness would include subject matter expertise, staffing, funding, relationships, political will, and internal policies and practices. Health departments may be at different places on the continuum of readiness with respect to these different dimensions. We found that it was rare for still health departments to have publicly available frameworks, strategic plans, or roadmaps outlining their approach to SEOH and equity, but it was more common for them to have educational, informational, or guidance type materials. Next slide. And next, I'll talk about our findings around framing and use of key terms. Next slide. So the ways that health departments use key terms such as SEOH, health equity, law, and policy with different audience varies across health departments. All of the participants and most of the scanned community health assessments and community health improvement plans use the phrases health equity and the social determinants of health to describe work related to addressing health disparities within the communities they serve. However, there were varying definitions and applications of what fell under the umbrella of health equity work. Sometimes health equity was framed in terms of representation, equitable opportunities, health and law policies, or used interchangeably with equality or the social determinants of health. Next slide. So next, I'll talk about health departments focused on racial equity. Next slide. So COVID-19 and the racial justice movement have forced health departments to really re-examine how they address health and racial inequities, both internally and externally. For example, internally, there have been some strategic planning and equity analysis tools developed. And externally, some health departments have been able to deepen their relationships with the community. At the time of our research, there were 32 state and local health departments and public health entities throughout the country that had made declarations of racism as a public health crisis. Next slide. And finally, I'll talk about challenges and opportunities identified in our assessment. Next slide. So funding continues to be a common challenge in terms of the type of work that's funded and duration of grant cycles. This was brought up in our interviews as well as in other engagements with health departments that we've had over the years. Interviewees talked about the lack of staffing capacity or expertise in law and policy within their department. And several interviewees brought up issues around community mistrust in government interventions. Even if the health department was not involved in the passage of those laws, it can be challenging to implement public health laws or build community partnerships within a community that has deep mistrust for government interventions. And finally, interviewees talked about some of the real and perceived legal barriers to advancing their work on SEOH and health equity, such as the rollback of public health authority preemption, and difficulty understanding or navigating laws and regulations. Next slide. So to address some of the challenges and needs identified in our assessments, we're developing curriculum on public health law. We're creating and providing trainings, facilitating communities of practice with peer-to-peer learning and cohort opportunities, and creating a suite of law and policy resources. Next slide. And to recap, our work has been focused on strengthening educational pathways for the future generation of public health leaders and building the capacity of current public health practitioners at different stages of their careers. In the next several slides, we'll highlight a few of those examples of this work underway. Next slide. So to support the next generation of public health leaders, we've developed sample modules on public health law, and we're piloting that curriculum in schools and programs of public health. We're also doing another environmental scan to explore different educational pathways to public health law outside of MPH programs. And we're in the process of developing a student competency model specific to public health law. Next slide. And last year, we launched a new public health law fellowship in partnership with the CDC. This is a paid opportunity for grad students and recent graduates to be placed within a still health department, CDC, or another public health law organization and receive some training on public health law. The goals of this fellowship are to strengthen the public health workforce by increasing diversity within the field, providing opportunities for hands-on training in public health law, and training the next generation of public health law professionals to respond to critical issues. And I will hand off to Alexis to talk about some of our other resources.
Thanks, Jessica. We also have, next slide, please. We also have a suite of online trainings and resources that span an entire person's public health career, whether you're a student and haven't yet entered the workforce, whether you're a professor teaching as undergrad or public health students, if you're early in your career or more experienced. If you're interested in learning more about public health law and its connections, I encourage you to check out our free online and on-demand trainings that are available through the Public Health Law Academy that we created in partnership with CDC's Public Health Law Program. I saw a question in the chat around kind of, where to start with public health law curricula, and I think these trainings and accompanying resources really offer that great starting point. I won't mention all the topics that they cover. Some of them are included on the slide here, but I do want to mention that we offer a free certificate if you would like to get recognition for all of the trainings that you take through the Academy. We also have customizable materials for instructors if you are interested in delivering these trainings to your colleagues or to your students. And the link for more information too is included on the slide, and I believe will be dropped in the chat as well. Next slide. I'm just going to quickly mention that we also offer opportunities for current practitioners, including our legal epidemiology learning cohort. I won't go into too much detail here since we're short on time, but again, we'll include a link in the chat for you to learn more. And if you're interested in upcoming opportunities for cohorts or for additional resources, please reach out to us. You can reach us at changelabsolutions.org, and we'll also include our contact in the slides. Next slide. Just to say, I also encourage you to poke around our website. We have a number of resources on various topics related to equitable policymaking and enforcement and the social determinants of health and public health law. I think a really good starting place is with our blueprint for change makers and our new interactive web tool on undoing the drivers of health and equity, which we will also drop. And then finally, just to preview that we'll have a number of new resources coming out later this year and early next that we've developed in partnership with CDC's public health law program. We've included some of those here. Again, please sign up for our listserv if you're interested in kind of receiving the most up-to-date information when those are released. Next slide, please. And then just to close, I wanted to revisit this roadmap slide because it hopefully helps piece together all of the resources and opportunities we just mentioned. And just, I think to quickly summarize too, I want to note that this represents just some of the many ways that we can and should support the public health workforce and how we can help build a more equity-minded public health workforce. But it certainly does not capture the entire picture. You know, we need more consistent funding. We need equitable pay, especially for roles like community health workers who are most likely to represent the community and have some of the lowest salaries. We need policies that support the health and well-being of the workforce itself and protects against harassment, among many other policies that empower and really support the workforce. But hopefully today, some of these resources offer a starting point for building and strengthening the field's capacity, particularly when it comes to public health law. Next slide. So just thank you all, and here is our contact information for Jessica and myself if you have any follow-up questions or would like more information. And I will hand it back to Karia.
Great, thank you all so much information here. So I'm gathering together our questions. So I think the first one that came in was related to a faculty person. I think you answered this, but is there anything else beyond what you already shared that would help direct people that are faculty that want to cover, this was someone from a school of public health that want to cover concepts for undergrad level? Would they find those in what you've already shared, or is there anything else that any of you would like to share that would help support faculty?
I'll just say I would definitely start with the Public Health Law Academy resources. I think if you're interested, we're also, as Jessica mentioned, curricula tailored for faculty and their students. It includes interactive case studies and uses the Public Health Law Academy trainings and curricula and builds on that and starts to embed that more into a classroom setting. So I think if you're interested in learning more about that too, and there's opportunities to pilot that curricula, please reach out to us at ChangeLab. We'd be happy to.
Great, thank you. Okay, let me just change my screen for a second so I can see the questions at the same time. Okay, so the question, how has public opinion of local public health agencies affected the abilities of local health departments to address the social determinants of health and social determinants of health and health in their communities? Or it says in counties, but I would say in communities overall. This person says, as a citizen, am I reliant on the local health department to take action to improve social determinants And health equity, if so, very concerned about the local elections. This question's related to a specific thing around library fees, but I think would be related to kind of anything in terms of the role of, I guess, the balance of power between sort of local action of concerned citizens versus the role of local health departments and local government. Kind of ways that communities can help inform the work and vice versa. I guess the sort of who leads, who follows in that process around the work of local public health organizations.
I can jump in to kick things off.
Okay.
I think one thing that is coming up in our work and in conversation with folks is just how do we think of more broadly about public health work? I think especially when we're thinking about the social determinants of health, public health is everywhere. So many different sectors are engaged in this work. So how do we think more broadly about the public health workforce and kind of the role that we all play at different kind of across the continuum of addressing public health and health equity? And so I think part of that, I think maybe the first step is changing the narrative around who can affect health outcomes. So I think that is a big piece of this too. So I'll offer kind of that thinking. My colleagues may have other thoughts as well.
Alexis or Sam, do you want to jump in on this one?
Yeah, I mean, I think I would just echo a lot of what Alexis said. You know, one of the things I've been really thinking about a lot and grappling with a lot lately is just that there isn't a great public understanding of what public health is and what it does outside of sort of public health settings. And so, you know, the ability of public health entities, especially local public health entities, to do their work and to support communities and to address social determinants of health feels very connected to what understanding people have of what public health is. I attended a meeting recently where someone said, you know, public health, people think that public health is like really just an extension of the medical system, and you know, it's these government actors who are out here trying to sort of impose restrictive rules on people. But that's not really what public health is, you know, and public health practitioners walk around with white lab coats and so on. And so I think some of and it's a difficult task and maybe an unfair ask particularly for practitioners working in local public health agencies where they're on the ground and they're doing a lot of work. They're you know, working communities. They're sort of working under challenging circumstances, doing a lot of work, not always a ton of resources. It feels sometimes a little bit unfair to ask them to also build a narrative around what public health is, but maybe the public health community and the community outside of public health, policymakers in other fields, you know, I think we need to develop sort of an effort to build relationships both within and outside of public health practice to help people understand what this is and why it matters, and the fact that, like, if you have a local park, that's actually related to public health. Like, if you have a local park, you have a place to go and do exercise and where people can be outdoors, and that affects your health, and that is a public health issue. And so I think in some ways just kind of echoing the idea that public health is everywhere, and actually law is everywhere, and the two work in concert in ways that people don't often realize. And we need to do a better job collectively to help build a narrative around that.
And I'll just plug that this is one of the resources that Alexis previewed. We are developing a resource around public health authority or health departments. That was one of the challenges or questions that we heard in our assessment. So stay tuned for that. It'll have some background information and examples of how this has been addressed in different communities.
Excellent, thank you. And then let's do this next one, which you probably all have things to weigh in on. If you're at the readiness stage, how do you locate authentic collaborators to implement systems and processes for effective and efficient change at the local level? So just kind of thoughts on, you know, partnerships to do this work.
I can take a pass at this first and feel free to jump in. So the readiness continuum, I guess there's different aspects of readiness, right? And I think partnerships fall across the entire process of law and policy work and working on health equity. I think you can start with just, you know, laying the foundation first. I think in our roadmap, there's different dimensions of readiness along within partnerships. Starts with just reaching out and kind of understanding what your partners do and how you could benefit, work together, align your goals and values. So, and then there are some action steps that you can take tangibly to strengthen those partnerships with other partners, also with community members, and build that trust with them. So I guess that's all to say, it's a process, and you can assess where you are and start anywhere, and there's always room to grow and strengthen that.
Other thoughts to add in from Alexis or Sam?
Just a quick thought. Both Change Lab and the Public Health Law Program do a lot of provide a lot of technical assistance to health departments and other actors, and try to help facilitate relationships. So I think starting with the places, you know, right, like the Leadership Academy, Change Lab, the Public Health Law Program, we all view ourselves as conveners and facilitators and provide technical assistance, and that can be a place to start. You know, I think initiating those conversations can help lead to other conversations and some strategic approaches to building relationships and partnerships.
Just add to underscore the role of the community too, and engaging with community members who are the ones who can really connect you with those partnerships as well, and they kind of like key and important players in that. So engaging with the community kind of early enough in.
Great. And then as a follow-up to that one with the partnership, in terms of kind of the legal understanding, the policy side, you have the tools that you presented, but how would you advise? There's a question about advising groups that are doing kind of more generalized sort of quote unquote improving health equity or trying to do community work. They're not clear on what policies relate because it's a big topic. So how do they sort of narrow it down, prioritize, try and figure out where that guidance is if they don't have someone that represents sort of policy work within their current work? Is one of the tools that you presented helpful for that, or do you have something else that's useful?
Oh, Alexis, go ahead. You can start.
I was just going to say the roadmap and assessment tool that Jessica mentioned earlier, I think is a great starting place. It will be available hopefully later this year, and it will be a series of questions that folks can take that looks at health department's institutional commitment, their kind of policy, and the social determinants of health and health equity, partnerships and engagement as a third kind of priority area, assessing data-driven strategies, and then the last factor is framing and communication. And so that is a great kind of just starting place to find out where you fall on that continuum of readiness that Jessica had mentioned. And then kind of the other companion piece of that tool is once you figure out kind of where you are across those different areas, we have a roadmap with concrete kind of policy action steps that you can consider in trying to, you know, continue your journey across that roadmap. So it offers some kind of concrete starting places depending on where you fall across those various areas.
Great, thank you. And then this question is specific to Change Lab. As a nonpartisan organization, how does Change Lab Solutions navigate the hyperpolitical environment that public health is now in the midst of?
It's a great question.
Yeah.
I can try to take a pass. I mean, I think at the core of all of this is really just uplifting the core values here that are shared regardless of where you fall across that political spectrum. We do work in all 50 states and so have very different audiences and partners that we work with. And I think just coming back to those shared values around, really wanting to build community, wanting to have healthier places, supporting, making this a better place for the next generation, I think is how we try to navigate a lot of this. I think too, when it comes to some of the legal tools or interventions, we kind of rely on what we call our 3 legal pillars around just legal integrity, really using science and data to support well-supported legal solutions. We think about legal innovations, kind of like what are the cutting edge opportunities to really explore the boundaries of the law. And then finally, legal intervention. So what are kind of like the ways that we can put those laws and policies into action and ensure that they are implemented and enforced equitably. So kind of like always rely on those as our kind of North Star when we're thinking about legal and policy solutions.
Great, thank you. All right, last big one that you guys might have some varied examples on. This person says from their limited understanding, they know that it's illegal to write race-based laws to try and address health equities, for example, lowering interest rates on mortgages for historically marginalized communities. Do you have any examples of ways that laws could be written that would help address health inequities by proxy?
So just to jump in, this goes back to that legal innovation piece. This is a question we get a lot, frustration around, we want to advance health equity, we want to be specific and kind of the populations and communities that we're trying to help, and yet we're running into the law as a barrier for this work. So what do we do? And I think that's where public health data really comes into play. A lot of the work we focus on is looking at some of the laws and some of the barriers we've seen in kind of like decades-long efforts to address structural discrimination and racism, and how interpretations of the law don't always allow for that to be effectively done, because we know that structural discrimination in particular is oftentimes invisible and it's just baked into the laws and institutions and systems. So to begin undoing that, I think it requires some kind of innovative thinking, and that's again where like cross-sector partnerships really come into play. And I think the role of public health is really critical in highlighting disparities in health outcomes and using that as the evidence base to support legal policies and actions.
Great. And any examples from any of you of like specific examples that would help people kind of understand ways of doing this, or ways someone's approach, any community you can think of that might have approached it?
I have one example of a recent success in this space. It's not community level, it's at the federal level. The Pregnant Workers Fairness Act recently passed to provide better protections for workers in the workplace who may need reasonable accommodations based on their status as pregnant workers. Reproductive health is like a complicated space, but the advocacy around this was able to make a case that appealed to a very broad cross-section of actors, some of whom you might not think traditionally would support sort of workers' rights. So I think there's, and we could unpack some of the advocacy around that, but making the case that it's better for sort of worker worker health and productivity, and the functioning and operation of our economic system is, a recent example, I think, that will ultimately translate, or has the potential to translate, to better conditions for working people who experience pregnancy, and also all the things attached to it, right? But the other thing is, there is space in the anti-discrimination domain that still exists, that I think has the capacity to be leveraged. Fair housing is one. Both with respect to discrimination on the basis of race, but on a number of factors, and with respect to access to resources ancillary to housing. There, essentially what I'm getting at is that I think there is still a space in the law around a number of sort of civil rights protections that maybe don't allow for the writing of laws to target particular racial groups, but that can be leveraged to kind of begin to make the case for how laws, as they're being implemented and operated, might have a discriminatory effect.
Got it. Thank you so much. All right. Thank you guys so much. Really good discussion. I'm going to now close us out. So as mentioned, when we started, this webinar is sponsored by the Leadership Academy for the Public's Health. We are opening our application period this week for NLAF 2024. As we're recruiting now, the application process will open again this week. Next slide. This program is for multi-sector teams. You define your sort of geographic community and do some work focused on advancing the health of your community. The program is issue agnostic, meaning you can come in with any issue in public health that your community is working to address. And again, we're looking for multi-sector teams. So you define kind of the sectors or organizations that are involved. Public health in general has to be at the state or local level. All the other partners you define depending on your work. We have an info session this week, tomorrow, and one on September 11th. These are not required, but will provide additional information to help you understand the program. So we look forward to hopefully hearing from some of you. And next slide. So again, thank you for joining us and hope you have a great rest of your day. And thank you again to our speakers.